In this video, we will look at how feedback can be used to improve student performance and ways to use clinical evaluation tools. Providing feedback to improve student performance is critically important, and it blends the fine art of communication. The working phase, or phase 2, shown in the middle of this diagram, is only effective if you take time to invest in the forming phase, or phase 1, shown on the left, to understand the expectation and evaluation methods of the clinical experience for that day. While you will want to provide feedback often, it is important to work with your student in helping them develop their own skill in learning to seek and receive feedback. In the development of the relationship, be sure to affirm open communication and that your feedback is meant to support their professional development. Come back to this value statement often. When feedback is situated in a manner that is in the interest, respect, and care of the student to facilitate their professional development as a professional nurse, it is more likely to be better heard and received. Good feedback really encourages active reflection. Strategies for providing constructive feedback include focusing on changeable things. Make sure you give descriptive statements, not interpretations. For example, stating, "The way you gave report was disorganized." Even if that's true, it doesn't outline specific behaviors. It places a judgment that the student was disorganized and may put them on edge. Furthermore, use statements can put that student on the defensive side. Even if you have a solid relationship with the student, this type of feedback does not help close performance gaps and over time can lead to deterioration in the relationship. Instead, what could you say? Maybe try, "Why do you think the oncoming nurse asked a lot of clarifying questions after you finished giving SBAR report?" This is a question that poses the student to think and develop their own system of reflection. Or you might try, "I noticed you blended a lot of the situation and assessment parts of your SBAR during report. How do you think you could cluster your information more efficiently next time?" Make sure that this feedback is in real time whenever possible. The sooner the feedback is given, the more effective it is. Many occasions will arise when you must defer feedback, though. You may defer feedback to avoid delays in care, avoid embarrassing a student, or for other reasons that are appropriate in the clinical setting. Because such delays are appropriate in those situations, it is important to make a habit of giving feedback as soon as possible. Choose the appropriate time. Give feedback when the student is ready to receive it. If it was after a near miss or a med error, it may take a moment to diffuse the situation and then come back. Of course, there will be situations where safety takes priority and patient care takes priority. And again, after that issue is closed and resolved, then we can work with the student in a private setting. It is important to not give feedback in front of other students or staff or patients. Critical feedback should always be given in a private place. Feedback provided should serve the needs of the student. Choose one issue at a time and make sure that the feedback is focused on the most critical behavior requiring feedback at that time. For feedback to be constructive, it needs to be actionable. So offering suggestions for how a behavior can be improved. It needs to be appropriate and relevant to the situation or task. It needs to be accurate and based on facts, not assumptions. And it needs to be aligned with the individual student's goals and objectives for the day. And it's important to never underestimate the value of professional role modeling. When you seek feedback, that speaks volumes too. So in the beginning, forming phase of the relationship, explaining how you prefer to receive feedback is also important to model for the student. And during the shift, also seeking feedback from the student on how you are doing in working with that student to develop and meet their goals. When you seek that feedback, it really models professional growth as an expectation and a reality in the workplace. Throughout the clinical day, you will You will be finding those moments where you're going to be providing constructive feedback that facilitates the student's development and builds to their performance evaluation. So let's look at the difference between formative and summative evaluation. Formative evaluation occurs daily towards the end of the shift. This daily feedback, or daily evaluation rather, is an assessment of the student's performance, and it's given by the preceptor. It takes into totality throughout the experience how the student has grown in meeting the goals and objectives through the day. Summative evaluation occurs at the end of the course, and this is the determination of competency attainment. As you approach the close of your clinical day, it is time to provide formative evaluation. Formative evaluation supports learning and improvement, whereas summative evaluation is an assessment of that attainment of competence. As a preceptor, your role in providing actionable, developmental feedback is instrumental to the student achieving the objectives of their course. The formative evaluation process feeds into the summative evaluation. The summative evaluation happens at the end of the semester. The course faculty compiles all of the formative experiences and formative evaluations, in addition to the students' clinical coursework, to determine a final summative evaluation of how the student has overall progressed towards meeting the course objectives and attaining a level of competency defined by the course. So at the end of the clinical day, it's time for formative evaluation on how students have met the objectives for that day. Formative evaluation is very focused. Here's an example. Formative evaluation tools will vary by the clinical course, which of course will depend on the level of the student in the program. Formative evaluation tools will also vary by the focus of the clinical day. It is the student's responsibility to provide you with their evaluation tool at the beginning of the experience so that you can see the performance criteria or what is expected of the student that day, and provides opportunities for students to meet, and then for you to provide opportunities for students to meet the clinical objectives. Student performance ratings need to be based on their competence, which is based on consistency and independence, not effort. We rate this development using a beginning, developing, accomplished, and exemplary scale. As you complete this tool, do not ask, did they do it? Ask yourself, can they do this behavior safely, consistently, and independently? The rubric is very specific in establishing different levels of performance. As you have likely experienced, receiving performance feedback is best done in a setting where there is privacy. Discussing student performance should be done in a space where it is private. The best practices in competency-based education are to allow the student to self-assess their performance and then to triangulate this with expert feedback. So having a student complete their own formative assessment is often helpful so that they can compare that with you. There may be situations where the student has not met the goals for the day, even with feedback. Identifying these practice gaps is critical and must be communicated to the student and course faculty. So let's look at specific situations of how to address providing performance feedback when a student is not meeting goals. We will use the framework: pause, assess, coach, escalate, and document. So here's the first scenario. A first semester nursing student is preparing to assist with morning medications. You observe the student scanning the patient's wristband, but not verifying the patient verbally. The student begins to administer medication and appears unsure when the patient asks, "What's that for?" You also notice the medication dose seems higher than expected for this patient. Let's apply the framework. So in this situation, your immediate action always is on safety first. We're going to pause with the student and say, let's pause and double check this together. Ensure that the correct patient identification is indeed in place and rechecking the medication dose and order. Next, we're going to assess the situation. Ask the student to explain their thinking. You may be asking the student, walk me through how you verified this medication. This is going to help you identify gaps. Was it a knowledge gap, an attention gap, or a system issue? Next, we need to provide some real-time coaching. A statement like, show me how you would determine the purpose of the medication, helps you identify the student's ability to show you what tools might be used in the EHR, or maybe a clinical reference tool that they have access to themselves, so that you can determine the student's ability to safely engage in medication administration. You may also reinforce expectations with using two patient identifiers, and to always know the purpose and dose before giving medications. It is appropriate at this point to model the correct process if needed as well. If an error ever reaches a patient, follow agency policy immediately. It is appropriate to notify faculty if there's a near miss or unsafe practice in the clinical setting, and particularly if there's a pattern of unsafe behavior. Lastly, documentation. Documentation is important to objectively document what was observed, the student response, and actions taken. This can be completed on the formative evaluation tool for the day. Let's fast forward this scenario further a little bit, and we'll use the same thinking framework. So later in the shift, the student is preparing medications. The student performs patient identification appropriately and begins scanning the medications without a secondary check in the EHR. So again, walking through and pausing action in real time to really slow down and focus on safety. At this point, you've already established the expectation with safe medication administration and provided some coaching on expected behaviors. At this point, again, doing an assessment of the situation is appropriate to understand where a gap is with the secondary check in the EHR. In this situation, we would then, again, document this. And at the end of the clinical day, when we're thinking about evaluating student performance with medication safety, which is a safety criteria on the rubric for the day, we would look at the criteria and then make a determination based on student progression and demonstration of behaviors throughout the clinical day. Read each criteria carefully, and you can pause this video to do that to determine where would you rate the student for the day. This student, as the scenario described, would be performing at a beginning level. If in the scenario you had provided the student with a prompt and they quickly addressed and rectified behavior and continued to proceed without any further safety concerns, you may also think and consider the student to be developing as well. Again, objective behavior-based evaluation is critical to improving performance, and when possible, providing feedback in real time helps close gaps before a student engages in a skill a second time. So let's look at a different kind of example where we might be working with professionalism in the clinical setting. So in this scenario, during a patient care activity, you notice a student repeatedly checking their phone at the nurse's station. Later, you observe the student texting while a patient is speaking to them. The patient appears disengaged and stops sharing their concerns. So let's continue to use this same framework. We're going to pause. We'll pull the student aside. Again, providing feedback is best done in a private space, so let's pause. Let's step aside for a moment, and let's address this behavior prompt and privately. We're going to be clarifying expectations at this point in time and stating what was observed. So stating, I noticed that you were using your phone while the patient was talking. I noticed that the patient maybe was becoming a little disengaged as you were on your phone. And as you do that, let's add an assessment piece. Can you be curious as the preceptor and get a little bit more information from the student? Can you tell me what was going on in that moment? This is critical because it may be useful information to determine, was the student using a phone or an iPad for Um, for example, were they using this for a clinical use, to pull up information to share with a patient, maybe a drug reference, for example? Or was the student using this for their phone for personal use? Coaching is critical here. Explaining the impact of behavior on patient safety or trust is always important. And in this instance, providing a statement like patient trust and communication was affected, particularly if the student was distracted and using their phone for clinical use. This is a totally appropriate statement to make to explain the impact of that behavior. If the student was using a clinical reference tool and sharing that with a patient and the patient was looking disengaged, this then becomes a different type of coaching opportunity where maybe you're talking through the student with the student of strategies to better engage the patient. But without that moment of curiosity and assessment to determine what was going on with the phone use in the clinical setting, we don't get that level of information. We're going to proceed through the scenario as if the student was using a communication device for a personal use. So escalating that really does warrant some insight into the behavior expectations and standards in the clinical setting. If this behavior is repetitious, notify the faculty, document a pattern. If there is any sort of privacy breach, HIPAA violation, or concerns with social media use that is in violation with your agency policy, please follow that policy and also notify the faculty. Again, documentation is critical with documenting behaviors that are seen in the clinical setting. This happens on a formative evaluation tool for the day. If you've provided feedback and coached, it is appropriate to just quickly describe what that was on the tool. When addressing professional behaviors as a preceptor, it is important to know program policies and expectations do exist and where to find them. These program policies specifically outline attendance, dress code, and professional appearance. So formative evaluation tools help identify outcomes for the day, and there are specific criteria to help assess student performance. But again, professional program policies and standards really help hold an expectation of professional behavior in the clinical setting. These expectations must be met with every clinical. To find these policies, these are linked on the program website under the handbook, and they're also on the Preceptor information page where you have access to this training. These policies and procedures outline attendance expectations, timeliness and uniform, dress code, etc. If you have concerns with how a student is showing up in clinical, it is important to understand what the expectation and standard is, so it is appropriate to reference that. If you have any questions, contact the course faculty. They are also helpful resources and can guide you on what to do next if there's a concern with standards and professionalism being met. In order to document this correctly on the student's evaluation form for the day, and this is going back to a student who's using a cell phone inappropriately in the clinical setting. Again, read the rubric and really under that professional behavior header, identify where would the student fall. And in this case, that student is at a beginning level. They're not meeting program standards, and that would be documented at the bottom of the form as well under comments. So let's do a quick knowledge check. We're going to wrap up with best response. So the question is, course objectives outline what the student is supposed to know at the start of the experience. These course objectives are going to be found on your evaluation tools, so that will help kind of give you some context here. That's false. Course objectives outline what the student is supposed to know at the start of the experience, which is not a true, that's a false statement. Really, the problem here is at the start. Course objectives really drive what the student is supposed to be able to do by the end. So objectives guide the creation of experiences that get us to outcomes as assessed on the rubric. What about true or false here? A preceptor is responsible for summative evaluation to ascertain competency attainment at the end of the course. False. Preceptors Your role is really to provide that developmental feedback and formative evaluation at the end of a clinical day. Summative evaluation and attainment of competence in the course is determined by the course faculty. Your feedback plays a vital role in determining the student's progress towards meeting objectives. It's a piece of the puzzle and a very important piece of information and feedback to the student that helps them know how they're progressing towards the course goals and overall competency attainment in the course. But ultimately, that summative evaluation will be given by their nursing faculty. That concludes our training on this feedback and evaluation segment. Thank you for your participation. There will be a separate link with instructions that will be provided for your continuing education credit for completing this training. Thank you.